There is something common among all of us. We work in an OHC and we need to give health education to all the factory workers in a factory. Hello everyone, my name is Dr. Snehil Pancholi, and in this video we are going to talk about health education for the factory workers. So the main objectives of giving health education to the factory workers is to prevent illness and injury, promote healthy habits, encourage early reporting, improve productivity and well-being of the workers, improve the productivity of the factory as well. So most common issue we face in a factory is heat stress and dehydration during the summers and at other seasons also. So we need to talk about heat stress very frequently. Advise the factory workers to drink water every half an hour. Every 30 minutes they need to drink little water. Use ORS whenever advised or whenever required. ORS is very important. Ask them to rest in shade if they feel any dizziness, cramps, headache, or any other kind of issue or minor illness. So dust and lung protection. Next is dust and lung protection. First is heat stress, next is dust. It is very common in the factory. Ask the factory workers to wear masks properly. Dust mask, respirator mask, all these things are available. Wet the dusty areas. Ask the factory workers to please wet the dusty areas before the work, before this kind of work, where they are frequently exposed to dust. Wash the face after shift. This is very important. Wash the face and eyes also properly. Report any cough if it is more than 2 weeks. Please remember this, cough more than 2 weeks, it might be a COPD. It might be a case of COPD. If cough is more than 2 weeks, then it might be a case of COPD and they need to report it immediately to the OHC. Please advise the factory workers. This please include in your health education talks and TBT. COPD is the main occupational health disease. Then safe manual handling. See, you can see in this image, already in this image, how this worker is lifting the load. This is the ideal way to lift the load. It is the load lifting training in this image. Bend knees, not the back. Advise the workers to bend knees, not the back. They have to bend only their knees, not their back. Keep load close to the body. Do not twist your back while lifting the load. Avoid twisting. Ask for help with heavy loads. 20 kg, around 20 kg or more than 20 kg, ask for help. Minor injuries and first aid. Ask the factory workers to clean the cuts immediately if they face any kind of issue. This kind of issue. Clean the cuts immediately. Visit OHC for dressing. Take tetanus vaccine. Never apply soil, cement, tobacco, tuna and all. Ask the factory workers to not do all those things. Alcohol and tobacco. Alcohol and tobacco awareness. Please advise the workers about all these things. It increases accident risk, causes heart diseases, lung diseases, oral diseases, cancer and all. Heart disease you are already aware of, lung disease you are already aware of. OHC can support quitting. So blood pressure and diabetes. Now we will talk about blood pressure and diabetes. They are silent diseases. Every OHC worker knows. Ask the factory workers to check BP regularly. Advise them to watch for excessive thirst, frequent urination, poor wound healing. These are the symptoms of diabetes. Excessive thirst, urination, frequent urination, poor wound healing. Now heart attack. If any chest heaviness the factory workers feel, sweating, breathlessness, they need to come to OHC immediately. You need to make them aware of these symptoms: chest heaviness, sweating, breathlessness. Then mental health. It is very important these days. Mental health issues need to talk about the mental health issues openly now. Mental health awareness it is called. Talking about mental health is not a stigma anymore. Please remember this. This is very important these days. Now, talking about mental health is not a stigma anymore. It is not at all a social stigma. Report and seek help early. If you feel any mental health issues like anxiety, depression, etc., please talk it openly. Do not suffer silently. OHC is there to help you. Tell the factory workers to sleep well. Ask them to manage their stress. There are various techniques: relaxation, meditation, avoiding the stressful issues. Now, personal hygiene. This is also very important among the factory workers. You need to educate them, advise them for proper personal hygiene. Wash hands before meals, bath after work, change the dusty clothes, and wash clothes properly also. So, key messages from this video. We will just have a summary. We will just have a quick look. Drink water, wear PPE, lift correctly, report illness early, visit OHC without delay. These all things you need to remember. Drink water frequently, wear PPE properly, lift the load correctly, report illness early, visit OHC without any delay. These all things you need to tell the factory workers. Thank you very much for watching this video, and work safe, stay healthy, go home safe. This is the OHC message. Work safe, stay healthy, go home safe. This is Dr. Snehil Pancholi signing off until we meet in another video.